like 90 degrees, and then fill in the move view. And then you can do the horizontal ab and ad since they're right here. Just and then you can have them bring out to the side.
How are their hands positioned? I was thumbs up.
Yeah. And then
Now I noticed you more closer to the shoulder. Is that like your hand placement, or is does it seem high?
Crossing the joint.
yeah,
Okay.
the elbow's right here.
Are you just like, would you show them where to go, or would you place them in that position? Like, she obviously
I mean,
knows.
you would just say, because in the instant, like, you've already done, technically you've already done range of motion on this person, so you should know whether or not it's taking you full range of motion. So you should just say, like, bring your arms up to the side. I mean, if they do like this, then you can ask them, can you bring it up higher, or you can just place them.
Okay.
And then external and internal rotation. This. And you just always put them in, like, mid position.
No, I thought she had us like leaning over them for that one. Is it the one?
I thought there was one that was down
It
here.
kind of supports the shoulder too. I think the other
I
arm.
think it's
Yeah.
so I don't substitute.
So she had, like, doing this.
Yeah.
Yeah.
And doing this.
And then she had it go here, right? Yeah. To a midpoint there, and then yeah.
Are we just overthinking this too much? I feel like I am.
Say that again.
No, I think she's just like, she
Where
has
your
to
hand is. Okay. Okay.
Thrive off overthinking.
Yeah, you would do both sides.
You do?
Everything you do is
Both sides? Oh, that is a good question. When you get to like the bicep and the wrist and everything, we're doing both sides?
I would assume she would want you to do both.
You know how sometimes for time constraints she like.
She would probably tell you. I mean, she'll if you go to do the other side and she says no, it's okay,
That's a
just
good
do one
point.
side, but-
Just keep on going, right?
No, I want to do both
She
sides.
mentioned that she was going to tell you which side, just so whoever is volunteering doesn't get worn out.
I think, Jen, I think we should just go to do both sides and she'll stop us.
Yeah.
It's in midpoint.
Going all the way down to the feet.
And then elbow
I feel like she's
extension.
not going to talk to us at all, and we're just going to have to do it.
So extension, you're just gonna have them.
It's the old grading project.
They're gonna be flex, because you do the opposite. And then so this is flexion. Yeah.
Andrea, do you remember her saying like, so what grade would you give this person? Did she ask you like that?
For the functional?
Or any of it?
Yeah, for when you do the manual muscle testing, she's gonna ask you what grade you give them. Most likely it's gonna be
5?
5.
Does she like try and have the patient make it worse or something?
I don't know how exactly. She's not trying to like trick you guys. She really just wants to make sure that you guys have the right technique.
Okay.
And I mean, it's gonna be hard for someone to like be like, oh yeah, I don't have any muscles. Like it's kind of hard.
Yeah.
So I think she's really just. I mean, when I did it, my person had like a 4 and a 5.
Oh, okay. I was just wondering that. I'm gonna throw this out.
Yeah. That's extension, right?
Yeah.
It's supposed to be closer to her ear.
You have to stabilize it.
Are you allowed to
I think we have it more than.
Are you allowed to hold that joint?
No, you don't hold it.
Okay, so you had it underneath? Yeah, 'cause this way I felt like it was going to be flat.
So like, okay, got it. And then how do you decipher between a 4 and a 5? Like, how would,
That's just something that you're gonna have to like over time. I mean, if it like make up like you can't like really describe.
okay. So like,
What,
if I
4 and
if I say like they were all 5s, if they did everything like what I thought was fine, would you?
I mean, she's not gonna retest them because obviously what you felt, what
felt
she
was
feels is different.
Okay. got
Do you
it.
think if you felt they weren't pushing
hard enough, just ask them to do it again? I mean, when you're doing it, you can say like push, 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 push.
Yeah, okay.
Wait, we're not asking them to move.
I know, I thought they were
After,
doing
like, after she asks you what you feel the grading is, like if she says, like when she asks the question, you know, like what would you do if they can't do that or whatever, and you say, move them to a gravity reduced position, would she make us like move them into that and do it, or just answer the question? Not sure, okay.
I'm not sure.
Okay.
I'm assuming she wouldn't. I think she just wants
Just
you guys
ask
to
the
know
question.
what the. Okay, that's supination and pronation. We'll see. So you just have them make sure that the elbows tucked to the side. Pancake drawing.
Did you say palm up? Is it palm up?
No, it's neutral. You just have to make sure that it's like tight to the side, your elbows tight to the side, and like at nice. So thumbs are up. Yeah. And then you just go.
Andrea, I thought you were doing flexion. I could see. Is flexion called when you're testing flexion? Is it palm up?
Yeah.
Yeah.
Yeah. That's
Oh, sorry.
Great, Sarah. So unprofessional.
Wrist flexion and extension. Yeah. So you can either do it on the table or like support them. And you just have them come to like midpoint, so like have them extend their wrist a little bit. And then just push down.
2 fingers, right?
You just have them flex the wrist a little bit.
Do you have them go in their full range of motion? Like, do you take their hand and move them throughout, or?
You should have already have done, like in a normal evaluation, you've already done it.
Okay.
Because some of our notes we have are like move it into fully extended and then move back to the range. So we didn't know if we had to like move them through it.
I mean, I guess I would ask her if she wants you to do it first. I'm assuming she's not gonna want you to do the range of motion just because it's.
I thought
gonna be
maybe
time-saving.
that would just be for the manual muscle testing, like, because you're only doing 2, right?
Mhm.
1 from each category. Like, I think when we do
Because
those
this, like,
ones.
dysfunctional is just like it's a quick and easy.
Okay, so maybe that like do the range. So if I was doing like CRL, I would move them through it and then go back. Okay. So I'm not.
Because I mean, I know like for at least for like lumbricals, like she has you like test to do like the other
That makes sense.
For wrist extension, you're using 2 fingers.
I just use
2 fingers. And where are you pushing on the hand?
for wrist extension.
Yeah. Just right there. Okay. Okay.
Doesn't seem radical.
Okay. So then we can do.
Is that all? That's all of them for the functional ones.
That is?
Yeah.
Oh.
There isn't that many.
What is that thing called again? The
So did I stop this
Okay,
time?
so
Dynamometer.
Do you have a diamonometer?
yeah.